Hello medicos. This is the clinical discussion of the gastrointestinal system. When we're starting with the cardinal symptoms. So basically there are 6 cardinal symptoms: abdominal distension, period edema, abdominal pain, nausea and vomiting, altered bowel habits, jaundice. Other relevant history considers fever, loss of weight, halitosis, hiccups, or other history which the patient may suggest for hematemesis, melena, heartburn, dysphagia, constipation and diarrhea. Now we'll start with the abdominal distension. So abdominal distension, there are 7 F's you have to remember. That is flatus, if any air is there because of aerophagia or increased intestinal gas. Now the second is fat, obesity, fluid, if any fluid accumulation is there, that is ascites. And then fetus in pregnancy, feces, what if accumulation because of severe constipation, and then fetal growth and neoplasm, any ovarian cyst is there or any pelvic inflammatory disease is there, and then the full bladder. Sometimes this abdominal distension pushes this diaphragm, which will not allow lungs to breathe properly, and dyspnea can occur. Okay, so now we go to the next symptom, that is the GI bleeding. So GI bleeding can be of 2 types: upper and lower GI bleeding. This upper and lower GI bleeding is differentiated on the landmark of ligament of Treats, but this is the anatomical landmark. When we go to clinical side, we have esophageal, gastric and duodenal causes. So the upper GI bleeding, it will have in esophageal cause, it could be esophageal varices. There is bleeding in the upper end of the esophagus or inflammation of esophagus, that is esophagitis. Esophageal cancer could be there, or Mallory-Weiss tear. Then to the gastric causes, gastric ulcer, gastritis. There are other causes also, but for an examination point of view, you can remember these causes. You can say about potent hypertensive gastropathy or gastric antrovascular ectasia. Coming to the duodenal causes, it could be duodenal ulcer, superior mesenteric artery syndrome, and that too in severe cases. Then there could be aortoenteric fistula. Sometimes pancreaticus or bleeding from the pancreatic duct can also contribute to the duodenal ulcer. Now coming to the lower GI bleeding. This lower GI bleeding could be further differentiated into 2 causes. It could be colonic or the small intestinal. In colonic GI bleeding, it could because of the diverticular disease. There is diverticulum which could get inflamed, and then the lower GI bleeding occurs. The small intestinal causes could be the angiodysplasia, the Crohn's disease, or any other infectious disease. This finishes the GI bleeding. Now let's go to nausea and vomiting. So nausea, you should able to know how to define nausea. It is a subjective feeling to vomit, while vomiting is the expulsion of the gastric contents due to thoracoabdominal wall contractions. Now what is the mechanism? Mechanism is also asked in viva. So you should know the nucleus tractus solitarius in the brainstem is solely responsible for the nausea and vomiting, reflex, and there is vagus and phrenic nerve involved. So vagus and phrenic nerve is involved, and the 5-HT3 serotonin, this serotonin receptors and the vasopressin pathways. This is the important thing which you should be able to tell the mechanism of nausea and vomiting. So we'll see with the causes. There are 3 types of causes: intraperitoneal, it could be extraperitoneal, or it could be because of drugs. So let's finish the drugs first. Antiarrhythmic, digoxin, OCPs, cancer chemotherapy drugs. There are other drugs, like you can write about antibiotics. Okay, after that you can write about antidepressants. I have not mentioned all of them, so the major things you remember now. Coming to the extraperitoneal. So the extraperitoneal combines of the myocardial infarction or the cardiomyopathy, sometimes labyrinthitis and the motion sickness. These are the ENT, like the labyrinthine diseases. Then comes the intracerebral causes, if any hemorrhage is there or abscess is there or hydrocephalus. Now this condition, hydrocephalus, can also contribute to conditions like nausea, vomiting, and then could be a psychiatric illness, that is anorexia and bulimia nervosa. So bulimia nervosa is also a disease where person feels nausea, having the nausea feeling. Now coming to the intraperitoneal causes, which is the most important cause. Now pyloric disorder, if any pyloric obstruction is there or colonic obstruction is there or superior mesenteric artery syndrome is there. Okay, now coming to infection, it could be viral, and it could be bacterial. Pancreatitis, appendicitis, gastroparesis, biliary colic, all these are the possible causes of nausea and vomiting. So in the next module we'll understand the other clinical symptoms, cardinal symptoms.